spinous processes, and then I kind of slide my fingers out just slightly laterally so that I fall more into the paraspinal muscles. And then I'm just putting pressure up with my fingers, and holding it. And then you can kind of lift and pull back towards yourself. Okay, and then move on to the next region or the next level. Same thing. And then again, if you notice any differences between the right and left, then try to focus on the tight side. So to do that circular motion, sometimes what I do is I just lean over more at the start, and then as I want to lift like superiorly up towards the head, then I just kind of lean back this way while still maintaining that pressure with my fingers. And then you just keep shifting further up. I don't think I include this in my notes, but if you want to be more specific, you can feel with the hand, with the fingers on one side of the neck. Like if you felt like more tension on one side, then you can just work one side at a time. But here it's best not to be doing this kind of lifting, especially just to like sit down and like put more focused pressure on that one side that you felt. I start off kind of at the same the base of the neck area, or as low as I can go, and my fingers are just like this, cradling the neck, and I go down and lift up, and then I kind of pull towards myself. Sorry. And just gradually proceed like upward on the neck, And it's not like you can do the same thing on every section of the neck. The neck has a natural curve to it, so you have to adjust to it. When you're lower on the neck basically has a curve this way. So when you start off at the bottom of the neck, okay. So after I've done that kind of tractioning motion on the neck, then I'm going to focus on the suboccipitals. So occiput is the back of the skull, and the suboccipitals are the muscles just under the rim of the skull. And these are really important muscles. People hold a lot of tension here. So what I'm going to be doing is bringing my fingers this way, and my fingers are going to be raised up onto the suboccipitals. And particularly for this technique, you're not really doing much of anything. I mean, you are lifting up with your fingers to get into the suboccipitals, but most of the work should be done by the weight of the head resting on your fingers. And actually, sometimes this can be a really tense or tender area on people, and then sometimes what happens is you put your fingers there, and then you can feel their head, feel them lifting their head up, because they're not
helping. They are helping.
Well, yeah, they're not ready maybe to relax fully. So sometimes you have to tell them to just try to relax their head back onto your fingers. You know, when the head, I'm gonna have you lift your head slightly, so I can bring my okay, and then you can. So you try to position your fingers under the occiput, and all you do is you lift your fingers up slightly and then just hold it there.
How heavy is this head?
Huh?
How heavy is our head?
It's usually it's supposed to be about 10 pounds, something.
They say 30, like a bowling ball.
Really?
Your head? It's not 3 pounds. Gosh, you know how big your neck muscles would be if you're over 30 pounds up on
Yeah.
Maybe it's less. 10, you said?
I think so.
Maybe 13. Maybe I was wrong. Maybe it's 13. I was, yeah, could be 13.
Pretty closer.
30. Oh my goodness.
Yeah.
It's a heavy, like a bowling ball. That's why.
Google it.
Yeah.
Average human head is 13 pounds.
13. Yeah. Okay. I'm
okay.
sorry. So it's 13 rather than 30.
Okay.
I was wrong.
So you start off with your fingers more in the midline, and then you gradually move your fingers out and do the same thing. The middle, like close to the middle of the, and then I'm gradually moving more
You're not
laterally.
lifting right now, are you?
No, I'm not lifting. My fingers are poking up, but I'm not.
Right here, right?
Yeah, right under the bone, like
Right there?
yeah, probably a little higher.
Right there?
Yeah, and then I just keep working laterally.
So it's into your hair. It's not like the bald spot. It's in the hair.
It
Yeah. That's
Yeah.
it.
yeah.
Right.
And then so remember when I was talking about that? I mentioned it briefly, but like where that place on the back of your yeah.
Yeah.
Sometimes when you get to like around gallbladder 20, you can kind of see their eyes moving. Like even when their eyes are closed, you can kind of see them like moving back and forth or something like that. It's kind of freaky because sometimes you can see their eyes like actually like vibrating almost, but yeah. But just try to work your way all around the base of the skull, yeah. Okay. And then I just kind of release the hand. Okay. So that's working a lot of the ways to do like neck flexion. Okay. One way is like just to use one hand and just lift, okay. Or two hands this way. Well, this is probably this way. Okay. Again, don't ever force a stretch. Okay. The one that I was taught was to, which is a little more complicated, is to lift the head and then cross your arms like above the wrist, and then my fingers are kind of pressing down on her shoulders, and then I'm just kind of leaning forward to flex the neck.
Which one you like?
This
Oh.
Alright. Those are just some neck flexion stretches, okay? But usually after that I go into working more the side of the neck. Okay? So what you can do is have the patient turn their head, just like passively turn their head slightly this way.